You're about to hear a story about helicopters, but it isn't really about helicopters. It's about how a system changes, how a region that didn't have a HEMS service built one, and how that doesn't happen just because of an aircraft. It happens because of people. In this episode, recorded at the Basics conference last year, we talked to Nigel Ruddell, a GP and pre-hospital doctor and the medical director for the Northern Ireland Ambulance Service, about the rather long, uncomfortable, sometimes political, human journey to building Air Ambulance Northern Ireland. We also talk about our old friend John Hinds, about charity and the NHS sharing a model that actually works, about dispatch, geography, cross-border responses, and what it really means when we say the helicopter isn't the intervention, but the team is. It's a really warming conversation about humility, about persistence, and about the quiet work that sits behind all of that high visibility kit. Now, before we get into the episode, I just want to say a big thank you to the team at the Big Sick, Anders and Daniel, for bringing us all together in Zermatt last week, and for enabling conversations like the one we're about to have on this podcast. And if you enjoy thinking about pre-hospital care or systems design and emergency medicine and its future, then please do have a look at the Incrementum Conference and Tactical Trauma. These are both amazing events that will really get your ideas going, make you think about emergency medicine, and just where we all fit into it. There's only a few tickets left for both, so you're going to need to be quick. And finally, a huge thank you to all of you who have downloaded MedPod Learn over the last 10 weeks since its launch. It's now got almost 5,000 medical podcast episodes on, all with those MCQs, and it's really gratifying to see that people are getting use for it actually all across the world. Enough of this introduction for now. Let's get to the meat of the episode. Here's the St Emlyn's podcast, and here's Nigel.
Welcome to the St Emlyn's podcast. I'm Ian Beardsall.
And I'm Simon Carley.
And we're here again at the Basics conference in Leicestershire, Sketchley Grange Hotel, and it's an absolute joy to have with us Nigel Ruddell. Actually, before he's done his talk, we've grabbed him in advance of him giving a keynote address later today, all about the development of pre-hospital care in Northern Ireland, a subject very close to us and I'm sure many listeners' hearts. But Nigel, before we get into that, just give us a bit of an introduction about you, who you are, what you do, and how you've ended up being here today.
As you said, I'm Nigel Ruddell. Originally, I was a GP in a rural country practice in Northern Ireland, in Dromara. But I always had an interest in pre-hospital care, and even as a GP, I would have worked regular sessions in the local emergency department. From that, I progressed into becoming a voluntary basics doctor after being asked to help out in some motorsport events. Thought I'd better get some better formal training in what I was doing, and that's how I met up with basics, and I've subsequently become an instructor for them. So I teach regularly on basics courses. I work regularly back home, volunteering as a basics doctor with the Northern Ireland Ambulance Service. And I jumped ship in 2009 and I'm now medical director for the Northern Ireland Ambulance Service.
And I know you're going to be chatting later on about the evolution of the Northern Ireland Air Ambulance Service, which anyone who's listened to St Emlyn's or been part of our community will know was part of John Hinds' legacy and a big thing of his that a name many people will know. Can you tell us a bit about what's happened in the years since all this was beginning? Perhaps 2014, 15, when this was first being talked about, maybe even before then. What's the evolution to getting a pre-hospital service in a place that has never had one, and perhaps it's a real struggle to get people to listen?
Okay. During the talk today, I'll be talking about the practical things that happened to get us to the point of having our HEMS service, but I'll be focusing mainly on the people involved and the influence they've had on me, the influence they've had on the public and the politicians who helped us get to where we are. The story goes way further back than anybody knows, and back in the early 2000s, we were already starting the work to look at how we might introduce a HEMS service. There were a couple of attempts at fundraising by various charities, which didn't come to much. But then John Hinds really gave air to the argument for providing a formal HEMS service. We were one of the last in the UK to bring in a HEMS service online, but John was passionate about the need for this and very publicly visible, particularly with his work through the motorcycle racing world, which has a huge following in Northern Ireland. But that came at a time when various others, including a very caring and dedicated charity, sided up with the ambulance service, our Department of Health, and it all came together. Tragically, as we know, John was killed in a racing incident. And this was at a time when we were all working together on the very medical teams that provide cover for motorbike racing. That accident happened in the south of Ireland, so we weren't there. There's a separate medical team which covers that event. And shamefully to say, I'm glad I wasn't there that day. I think we all would have really struggled, and my heart goes out to our counterparts in the southern team who were there that day. John's influence, it created a lot of public passion, and came shortly after he'd made a very public call for the trauma response that the HEMS service would provide right across Northern Ireland. And this really gave it legs. And the politicians then decided that the time was right that we would introduce the HEMS service to Northern Ireland for the first time.
So, Nigel, there's a variety of the ways in which air ambulances are funded across the UK. How have you tackled that in Northern Ireland?
We have a model that isn't often seen. We have a partnership, and I have to say a really good partnership, with the Air Ambulance Northern Ireland charity. They have a fantastic fundraising team. And I have to say in Northern Ireland, this is one project which really has captured the imagination of all of the community. They raise the money for the aviation side of things primarily. So that's the helicopter. In fact, we have 2 helicopters, one of which really is spare for when the other is being serviced or has any issues. But 2 helicopters, we provide a 12 hours a day service. The charity also provides for the air base, the hangar, the service, the maintenance, the fuel, everything to do with the aviation side of things. Whereas from an NHS side, we have the Ambulance Trust, the statutory ambulance service for Northern Ireland, who provide all of the clinicians. We contract the doctors from their NHS trusts. They all come from an ED or critical care background. And we have the paramedics who effectively work full-time for the ambulance service as well. So that partnership is a really positive thing. And without the charity, we quite simply wouldn't fly. But the charity element means that everybody is very passionate and enthusiastic about what they do.
I think one of the great advantages of working in pre-hospital care in general, in the air ambulance, and also here at the Basics conference with Basics clinicians, is it's a really enthusiastic, keen, focused group of people. They're just wonderful people to work with. They're there often as volunteers and for Basics, or even if you're doing with the air ambulance, they're often doing it at extra shifts at weekends away from their families, away from other things that they could be doing instead. And coming at a conference like this, I think it's just been fantastic to meet up with so many people like that. You're describing exactly that in Northern Ireland. I absolutely see that. And it's really come through from what you talked about.
I'm very keen to reflect the work that people have done. New people come along to a service, new people have new ideas. We're hearing all through this conference about new technology. I think there's always a risk that we forget the work that people before us have done. And a lot of what we do and deliver in pre-hospital care is because somebody had an inkling they could do something better and had a passion to deliver that. So I think we should always stop and pause and reflect on those people who've gone before us and what they have done to get us to this point.
I've been lucky enough to spend quite a lot of time in Northern Ireland, and one of the things I think people don't necessarily appreciate is the geography of Northern Ireland. So you have the Belfast area, which is quite busy and it's an urban environment, isn't it? Although not a massive city. But when you get out to the west and other areas, it's incredibly rural, really spread out with quite long distances where, you've got this potential for the difficulties of projecting enhanced pre-hospital care across that region. Must be a real challenge.
It is. As you say, we're a very rural population in UK terms. We have a population of about 1.9 million. The geography of Northern Ireland is essentially a ring with a hole in the middle, which is the biggest lake in the UK, Lough Neagh. So we often have to go around that if we're travelling by road. So the introduction of a helicopter service, which can reach anywhere in Northern Ireland from their base just outside Lisburn, can reach anything in Northern Ireland within about 25 minutes. Now, we've always taken, with the introduction of the HEMS service, a very humble approach. And we have to recognise the work of the road crews and the ambulance service, who may well be first on the scene. But our model of delivery of a HEMS service is charity support for the aircraft, for the pilots, for the fuel, for the aviation side of things. And all the clinical care and clinical governance is provided by the ambulance service. But that partnership works really well. And that's probably down to a lot of the individuals and characters involved who have been passionate about delivering this for the population of Northern Ireland.
So your service that you've got, Nigel, is now a medical paramedic model?
That's right. There was some debate around how quickly we could introduce that model, but we always had the vision that it would be a doctor paramedic model. And we are lucky that we have an excellent clinical lead in the shape of Darren Monaghan, an ED consultant. And we have built a team along with lead paramedic Glenn O'Rourke, who have focused on getting a team who, and I use the word again, are very humble about what they do. Their drive is absolutely improving the care that we deliver to people. And in a very short space of time, they were able to put together a team who are really dedicated and provide a 12-hour-a-day helicopter emergency medical service.
Just going back a little bit to the genesis of where this came from. Obviously, Basics has been around for a long time. We've got people at the conference who are founder members of Basics and clearly been doing it a long time. How did you manage to get the people on board? What goes on behind the scenes? Obviously, Northern Ireland works slightly differently to other parts of the UK. But where did you get to where you had to form a charity, you had to get the support from the health board, you had to get the support from medical colleagues, you had to get people within hospital to accept this was about to happen? Can you give us a bit of an idea about the amount of work that takes and the amount of diplomacy and politics you go through and what you might have learned during that?
Okay. First of all, politics I try to avoid. Northern Ireland is a place where politics obviously are very much talked about, and sometimes it's best to stay out of those arguments. What we focused on was our passion for delivering high quality care. We looked at the work that was being done in other parts of the UK. There was quite a bit of work to do, even convincing some of our medical colleagues about the need to introduce the service. Northern Ireland is not a huge place. We're only about 70 to 80 miles in diameter. And given the constraints in the health service financially, a lot of people were worried that is HEMS some sort of Cinderella service where we would throw money at something that won't actually improve the level of care. But the evidence base was growing all the time. And when we were going to introduce it, we were adamant that we would focus on that model of the doctor paramedic. And to emphasize the point that I have to stress a lot when I'm talking publicly about our HEMS service, where people imagine that it's about just getting somebody there quickly, getting to the patient quickly in a rural setting and getting them back to hospital quickly. I always stress that the real benefit of our service is the people that travel on the helicopter and the care that they deliver to supplement the work of the ambulance crews and deliver those high intensity, low frequency interventions, which otherwise would have to wait until somebody arrives at hospital. And it's those people delivering that care which makes a huge difference.
One of the other things which I think all of us in pre-hospital services find difficult is the dispatch issues. And of course, you've got obviously the aircraft and the staff there, but there's other aspects about making sure that you're getting to the right people and working with the ambulance service itself on that interface, which I think pretty much everybody finds really challenging, don't they?
We've been really lucky there because all the governance and clinical side rests with the statutory Northern Ireland Ambulance Service, and we only have one ambulance service for all of Northern Ireland. We've cracked that really well. We have one of the air ambulance paramedics every day based in our dispatch centre, and we have one emergency dispatch centre for all of Northern Ireland based in Belfast. So as calls come in, they're constantly screening the calls. They're looking out for those calls which right from the start, you just know you're going to need that level of critical care, and that's immediate dispatch. Other possibilities are if a crew arrives on scene and either something is worse than has been described on the phone, or if they realise, having assessed the patient clinically, that they would benefit from critical care interventions, they of course request secondary backup. But the other innovation we've had recently is that we use video conferencing. We can contact callers at scene. We can send them a text to their mobile phone, which effectively opens up the mobile camera at scene and allows the critical care paramedic on the air desk to see what's happening, to assess the situation, and to realise that actually the helicopter is warranted or the HEMS team is warranted and dispatch. So we work hard, we audit regularly to make sure that our dispatch isn't going to things needlessly. At the end of the day, it's an expensive business. We don't want to waste the charity's hard-won gains in terms of using extra fuel, etc., and going to calls that aren't needed. And at the same time, we don't want to miss calls that if we deployed to something that was minor, that potentially we could miss out on a major trauma elsewhere.
Is that the GoodSAM app you're using for your
That's right. Yeah, that's others are available, as they would say in the BBC. But we've been utilising the GoodSAM app in our control room for a while for the HEMS desk and also for some of our urgent care paramedics working within the control room, and we've found it a real benefit.
Just says a lot about the community, because Mark Wilson, who was part of the GoodSAM app right at the beginning, was an old friend of John Hinds and all part of that same group. And it's all, I think that John will be rather pleased, and Mark, I'm sure, is delighted that you're using that there. One of the things in Northern Ireland that you maybe have that is a bit different to us is when we cross-cover for services next door, we're often cross-covering for a service in a next-door county. Do you have to cross-cover into the south of Ireland, or is there a hard border which you can't cross?
Okay, that is a bit of a hot potato. In Northern Ireland, we struggle in terms of mutual aid. In England, if an ambulance service is under serious pressure, yes, a neighbouring service, it's a very artificial junction between counties and between ambulance trusts. In Northern Ireland, we have our colleagues in the south of Ireland, the National Ambulance Service of Ireland, as they're known. I have to say we're on really good terms with them. We work regularly. We do respond across border to help out at emergencies frequently. And most notably, we responded to a disaster in Donegal at a place called Creeslech a couple of years ago, which was an explosion at a petrol station, and tragically many lives were lost. And I remember getting that phone call that this call was coming in, and our colleagues in the south were looking for it to see if we could support in any way. And the decision was very quickly send everything. We sent the helicopter team. We sent our heart team, which was a capability that didn't at that time exist in the south, to work in that very dangerous environment. And I know that if we had the same problems, that they would help us. And even at times of pressure, for either service, we help each other out across the border. So that partnership certainly exists already. The helicopter does occasionally cross the border. There's no difficulty with the helicopter geographically crossing border, flying into the other jurisdiction. We do have to be careful around issues of registration of doctors and paramedics working cross-border. But because it's not happening all that frequently, then we're essentially acting on a humanitarian response basis.
You've described a bit where you started and where you've got to. What do you think the future is for Northern Ireland's air ambulance?
We are a 12 hours a day model, and we're not yet engaged in night flying. Obviously, the aircraft can be limited by weather restrictions, etc. So at times when the helicopter is not an option, our team will respond by car. Part of the story behind it, you're familiar with the name, the call sign Delta 7, which has long been associated with John Hinds. Now, when we introduced the service, a lot of the public expected that call sign to be used for the helicopter, but for aviation reasons, I'm sorry, we couldn't do that. All the UK air ambulances are HeliMed call signs. However, the Delta 7 call sign was one that I actually gave to John when he became a voluntary basics doctor, along with the ambulance service back in about 2012. And we certainly, when John's tragedy occurred, we hadn't the heart to use that call sign for anything else, but we kept it. And when the helicopter team went live and they had the response car, we gave the response car Delta 7. So in some way, that memory lives on.
And you were saying that you're actually Delta 2.
Yes, that just reflects my age more than anything. My predecessor, my boss, David McManus, who again was an inspirational figure in pre-hospital care in Northern Ireland, was Delta 1. I'm Delta 2. And even though I'm now director, I've just hung on to the Delta 2 call sign.
Nigel, it's been absolutely fabulous to talk to you. Thank you so much for your time. What a joy to hear where you've got to. And good luck with everything you're doing in the future. And good luck with your talk today. Can't wait to hear it.
Thank you very much.